Good afternoon, everyone, and we'd like to welcome you to the 95th session of the Flint Community Webinar on Coronavirus. It is January 7th, 2022. January 7th, 2022. We'd like to say Happy New Year, and I know in the midst of everything that's going on, that's a little bit challenging for some of us, but we are thankful that we are now here for a new year, January 2022. This Flint Community Webinar Coronavirus is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. I'm excited to be here today as your host, your moderator. And again, in these 95 weeks, none of us ever imagined we would be here today. But as a co-director of the Healthy Flint Research Coordinator Center, again, we'd like to welcome you. We have some phenomenal individuals that'll be here to talk to you today, as well as many of our 45 plus partners who have joined us for these 95 weeks. We want to let you know that one of the reasons we started this webinar was that we would be able to bring a local context to this global pandemic. And we are seeing more and more the need for the local context. So thank to each of you who joined us, even over the holiday weeks, for the webinar so we could continue this series. Today, we have an exciting, again, as I said, an exciting session for you. We're going to talk about COVID and heart disease, COVID and aging. We'll have a medical moment for you, and always an update from the Genesee County Health Department. We'll hear from a representative from the city of Flint as well. It is so important that we understand the things that are happening in our community. Today, we want to highlight some of our partners that have been with us over these 95 weeks. Consumers Energy came and provided for us information about what's going on with respect to the energy and COVID. Metro Housing was one of our partners. Blue Conduit, who will be coming back again to give us more insights, as well as the NRDC talking about the Flint water crisis. So again, we appreciate these partners. We would not be able to do this work without them. And of course, hopefully you're gaining some insights that are helpful to you. I'm going to ask our team of roundtable specialists, I'm going to call them. They're able to answer so many different questions. And even some of the questions we don't have the answer to now, because I was reminded by Dr. Reynolds, this is an ever learning process. So our panelists today, Dr. Reynolds, Dr. Deborah Verholden, let's see, we've got Dr. Pam Hacker, yes, has joined us today for a roundtable. You're going to hear from Yoshika Albert from Valley Area Aging, and we also have a special guest, Dr. Keith Aronson from the University of Michigan Medical Center. And our friend, Dr. Paul Kilgore, is here with us as well. So I'm gonna ask our panel. I've pondered about this for the last few weeks and the days. We are now 95 weeks into this, 95 weeks, which is actually less than the overall pandemic conversation. It's been 25 months now that we've been talking about COVID-19. And in talking about COVID-19, even though we have testing, we've now gotten vaccine, the numbers are still growing. Fewer deaths have been reported. However, there's an increase in the number of people that are ill and that are in the hospital. So I'm going to ask our panelists, Dr. Reynolds, I just want to start with you because you gave us some real sage and sound wisdom, as you always do, about this issue. How can we think about what's going on now?
Well, the first response is humility. We are in a pandemic. We haven't experienced one in 100 years. And we are learning new things as we go along. We're learning about a new virus. And then we have the change that's thrown in due to the variants. And so we will try to apply the effective tools that we have used in the past, but this virus and the circumstances under which it's operating may cause us to have to update or change some of those practices. And so we should always let folks know up front, this is what we know today, and we're watching to see what we'll know later. And the other caution I put out there to our audience is the media does let us know there's a development, But we as professionals, we're required to get the details. We're required to get authorization. We're required to get the whole story and the date when something will happen. So many times you'll hear something on the news and we're as happy as you are if it's good news. But we're also cautious about saying when there will be a rollout. Because if you remember, we had vaccines, but for a while we didn't have syringes and needles. For a while, we could not get them to where they needed to be. Then we couldn't get the people to where the vaccines were. So we figured out a way to take the vaccines to them. So this is a constant challenge that we're going to have to adapt to.
Thank you, Dr. Reynolds. When you talk about adapting, and I want to just swing over to Dr. Deborah for Holden as our resident epidemiologist. And I'll say one of the important things is we have people here locally that we can actually touch and talk to and we can have confidence in. I must say, Dr. Deborah, I've read and seen articles and you're all over the place nationally. You're on major national, you've even been on with Dr. Reverend Al Sharpton.
Yeah.
You're quoted in national articles, but we're thankful that you're here with us in our local community, so you can give us some understanding of what this data actually says, even when it's coming out. How do we read it? It isn't always as clearly understandable when you first look at it.
So a couple of things I'll say about the data. Number one, the cases are increasing. Let's go back a couple months ago when it looked like nationally the trend was sort of going down. That kind of missed us in Michigan. Our numbers were continuing to kind of creep up when nationally it looked like it was going down. And then we got what I call the wildfire variant, Omicron, which people, keep talking about. It spreads more easily. They talk about milder symptoms and some of those other things. The thing I want people to focus on is the fact that it spreads more easily, right? I call it the sticky factor. If there was a sticky factor rating, Omicron is a lot more sticky. It seems to stick in people's noses and throats and proliferate more. And so more people are getting it, right? Like for the, attendees or others, I feel like everybody has COVID right now. And I know not everybody has COVID. That's like a little hyperbolic, but a lot of people have COVID right now.
Yeah.
And not only do a lot of people have COVID, a lot of people are on their second infection. And those people, many of them are people who've been vaccinated. And I love how Dr. Hackert says it. Whatever your, vaccination status is, subtract 1. So if you only had your, 2 shots of the Pfizer or Moderna, you basically have the protection of if you've only had 1 shot. So now, like Dr. Reynolds points to, the science is evolving. People have to really kind of move with what we're learning. It looks like the best protection is coming from being fully vaccinated and then getting that booster. Even though there's been no national change in what it is to be fully vaccinated, we know to get the maximum protection, you need to be vaccinated and get that booster. Well, what does that mean? Because a lot of people then say, well, if the rates are going up and all these people are vaccinated, why should I bother to get vaccinated if I'm still going to get COVID? And I want to be super duper clear. And that is a scientific use of the word super duper, okay? Super duper clear. The vaccine is very good at preventing people from having severe symptoms, reducing their risk for hospitalization, reducing their risk for death. That's worth it. And the reality of it is when you're vaccinated and boosted, there looks to be some protection for people and even, sort of having the virus be able to proliferate. So there is still like some potential preventative, protective benefits from you sort of like, rising up to the level of being a case where you are down and feeling bad, even if you're at home and not in the hospital. So, because the vaccine is safe and effective, it's a good thing. And we need that because the numbers are going in the wrong direction. When we get to that piece of this, I'll show you the numbers. They've doubled in Flint and Genesee County over the past week. We've doubled the number of COVID cases. And the unfortunate piece is because even though this looks to be, and I'm just sort of saying that cautiously, a milder form of COVID that does cause less death, less disability, because the numbers are so high, we are still overburdened. Our hospitals with people who need to be hospitalized and get specialty care for their COVID. And we're not seeing the big move in the number of hospitalizations or deaths from COVID because the raw numbers are going up so much because so many people are getting it. So I'm gonna take everybody back to the basics. It's about prevention.
Yeah.
And Dr. Reynolds said it, vaccine is the foundation of it. And then the masking, the avoiding those large events, and good hand hygiene are the things that people have to continue to do.
And so that gets us to the public health element. And Dr. Hackert, who is our officer here, our public health officer is leading the Genesee County Health Department. Just want to just have her talk to us a little bit because she's been really trying to get us to understand the importance of following these universal precautions, masking, and even though some pushback, she's been one of the health officers in this state particularly who has made a stand. So Dr. Hackert, in the midst of all of this, how do you help us out today? I know you put out a wonderful letter to the schools to talk about the children. So help us this morning, this afternoon with where we are. Dr. Hackert, you're on mute. Okay, so her audio is not working. While you get some help for that audio, Dr. Hackert, I'll do.
How about now? Is that working now?
There you go. I hear you now.
Okay, it must be my connection because I connected it to my computer on my iPad. If I take that off, the iPad works. So one of the things I wanted to really do with that letter was the section, if anyone's read it or seen it, there's a very large paragraph. And I said, if you're interested in the details, read on, and if you're not, skip this paragraph. But it talks about why we can go to this shorter, potentially, shorter isolation period and quarantine period when Omicron becomes the vastly dominant variant in the state. And it has to do with the fact that, just like Dr. Verholden said, that it's very sticky and it transmits easy and you get onset quicker. And so the incubation period is shorter, and then we'll be able to identify in a smaller amount of time those who have had it. And combining that with the fact that it appears to be milder, you can go to it. But right now, we still are at about probably about 30% of Delta in the state, and you don't know who has what. One of the things that kind of gives a hint to it is, are you getting a fever? That tends to be more Delta. Are you getting a scratchy throat? That tends to be more Omicron. But it's really, they both overlap. And so that is one of the reasons. I know the big reason that it's been heard and is being used on the media a lot is that it's more convenient for everyone to have fewer people out of work, like back to work faster. But there is some scientific basis for it as well in terms of this shorter incubation period. And so that is a piece of it. And that's what we're kind of waiting for. The CDC just gave some new guidance on that on January 4th. And they were holding off with the schools, the K through 12 schools, said it's going to follow something new like this, but we're coming out with new guidance. That came out last night. And now we're kind of waiting to see what the state's interpretation of all those new guidances are, because again, the CDC is looking at the whole country, and we are looking at our state and our county in particular for safety measures. So while we're wondering how this is all going to play out, what we do know is Omicron is very easily transmitted, and you can give it to other people. You do want to keep wearing masks in indoor spots. If you're in a crowded outdoor setting, I would still advise wearing a mask there. But really, the vaccine is the key component to it, and we're going to keep going forward with that.
Thank you. You mentioned the difference in the Delta and the Omicron. I'm going to just ask Dr. Kilgore. He's been with us before, and he's our infectious disease doctor here. Dr. Kilgore, can you just give us a little bit of understanding about that distinction between the COVID variant and, the Delta variant and this Omicron variant?
Sure. Hi, everyone. Thank you very much, Yvonne. Great to see everyone. So the original strain that we discovered back in January of 2020 the original Wuhan strain, had a spike protein, just like all the strains of COVID-19 virus, the SARS coronavirus 2. One of the things that the virus has been able to do very efficiently over time is change its structure. So this is a very smart virus, and it knows that it needs to attach to one key receptor, which is very, very common in your nose. It's in your throat, lungs, and many other tissues in your body. That is the Ace2 receptor. ACE2 receptor has the ability to attach to the virus and vice versa. So the virus knows this, it's very smart, and over time, in people, in us, it's been able to change, evolve. And one of the smart things that the virus has done is changed its spike protein. It was attaching okay in the beginning in January 2020. Then it went on to Alpha and then Delta and eventually now Omicron. Through that process, through that evolution, the virus has been so smart to make changes in the spike protein that make it better able to bind to the ACE2 receptor. So what that means is that it's possible that with the new variants, you actually may be infected with fewer virus particles, yet the virus is still attaching. And as Dr. B mentioned, attaching with a sticky feeling. So when it's there in your nose, it's not going to let go. And so the key is to block it. And blocking the virus through vaccination, through masking is really key. But that mutation, we call it a mutation, but it's basically changes in the spike protein, have been key. There have been other changes in the virus, in the nucleocapsid part of the virus, that's the interior part, more or less. And these changes in the virus really mean that we have to up our game. I think we have to become more aware of the way that we can block the virus. So that mask around your face, and I'll talk about this later, a nice tight seal around your face is going to be very, very important. And we'll talk more. I have about 12 slides we'll show later. Thanks.
All right. Thank you, Dr. Kilgore. I want to go back quickly to Dr. Reynolds, because he started us off, and Dr. Deborah kind of enhanced it a little bit, the Swiss cheese model, the layers of protection as we prepare to just close out today, those layers of protection. Just give us a little bit of an insight on that, because this is something we need to continue to talk about. Dr. Reynolds. Okay. Dr. Verholden, can you hear me?
Oh, I can. I'm sorry. I thought you were calling on Dr. Reynolds. I was like, oh, I hope Dr. Reynolds really brings it home.
Oh, yes.
I didn't hear. Okay, there he is.
Thank
No,
you.
that's okay. But so because him and I are kind of like, I feel like I echo Dr. Reynolds, and if we were a choir, we could be a choir or a duet. The thing I want to note is this: our messages have remained consistent. The one thing, and I'm just so super grateful for our collaboration with our partners at Michigan Medicine and the University of Michigan. So Dr. Kilgore and Dr. Aronson, I'm just so grateful that you all are here. The role of the mask remains important in our mitigation strategy. And what we're now learning is the need, and I've done it, Yvonne, I've shown people how to put the mask on and take it off properly. What masks really protect you. Now we're really learning exactly what mask you need. So the message hasn't changed. We're just making it more specific and trying to have it be more empowering for people to really understand exactly why you need the mask that you need, to fully protect you. So I'm excited, and I want to make sure we have plenty of time for Dr. Kilgore's 12 slides. And I'm gonna be an ambassador, Dr. Kilgore, and whatever you bring forward, I'm going to replicate it and make sure that I bring it forward in our conversations with community. But the message remains the same. The vaccine still works and provides important protection. Masks still work. We have more information about the vaccine now. We know we need to get boosters, et cetera. We have more information about masks, and we know exactly what type of masks that we need and how they need to be applied to have them optimally work. And good hand hygiene and physical distancing also still works. So, yeah.
All right. Thank you, Dr. Deborah. And I saw Dr. Reynolds. I saw you put up the picture. So I asked you to show that picture right quick, because people can pull this up.
Hopefully we can post it on our website because my camera is not all that good. But also remember another layer of protection is your brain, thinking through and having a plan before you enter into a situation, and consider your choices and the consequences. And the second part of that is, I give pardon to the cardiologist, your heart, and that's your emotional heart, your concern about the people in your household and your community. Every choice you make will probably have ramifications and considerations for the people you care about and even the people you don't care about. So that's why it's so important that we use those multiple layers of protection. And if you don't know the information, go to a credible website. And sometimes it's confusing, but it's credible. The CDC website, our county website is excellent. Our state website has some information. And if you don't know how to get to those places, that's why we're here now. But also, pull in one of the technically savvy young adults in your household too, and go over those things and then write your questions.
Yeah. Thank you, Dr. Reynolds. You gave us a good segue when you talk about caring about others. And we have with us Ushika Albert, who is from the Valley Area Agency on Aging. That's a part of our team today. And she is, as president and CEO, looking out for our seniors. So we wanted to talk a little bit about how this has affected some of our seniors. So can you give us some insights on that, Ushika?
Good morning, everybody. I so appreciate Dr. Reynolds saying that, because so often I hear, specifically young people saying, especially in the beginning, if I catch it, it's just going to make me sick. It's just like a cold. It's just like the flu. And I stress to you, but it's not only about you. It's about, the fact that you could take this home and give this to your grandmother, your aunt, your grandfather, your mother, your father, or someone who has an underlying condition that may not even know that they have an underlying condition, or you may have an underlying condition and may not know that you have an underlying condition. It's not only about you. It's about the people that we love and that we care about. And if you notice that, our seniors are the ones that are passing away from this disease. So I'm begging people, please be aware that this virus does not, I said disease, but this virus does not just affect you. It affects everybody. It affects everybody. So please take precautions. If you're not going to take them for yourself, please take them for those that you love and those that you are around.
So what are some of the programs and services that you've had to kind of ramp up during this time for our seniors in the midst of all of this?
So we have lots of openings for programs for our homebound seniors. We've had to ramp up programs such as our home delivery meals. We're taking extra precautions because we don't want our seniors to go out, especially those that are frail. And we serve populations of seniors that are frail and mostly homebound. And so we don't want them to go out at all if possible. So we've had to ramp up actually all of our programs, but specifically our wellness check programs, our home delivery meal programs, our personal emergency response system programs, because you have seniors now that are even leery about having home health aides come into the home. And quite honestly, there's a home health aid shortage. Not even before the pandemic hit, there was a home health aid shortage. The pandemic has made it worse. So we have to augment those services or supplement those services with other services. Person emergency response system, or PERS, is that, that button I've fallen and I can't get up. So we've had to supplement with that because we want to make sure that we're able to check on our seniors and get to them if we need to. So we've had to get more sophisticated personal emergency response systems in the home. Telehealth we have so that we can do various types of care management programs without us going into the home, because not only am I concerned about our seniors, I'm also concerned about our team. Yeah. So we do telehealth type services so that we can make sure that we're still monitoring, assessing, and reassessing our seniors, and still having contact with the physicians and the other services that we have going on in the home, so that we can make sure that we're making sure that our seniors are safe.
Right.
And a ton of other programs and services that we have we do a lot that a lot of people don't know about, unfortunately, until the caregivers and the seniors are burnt out. So
what's a number if someone needs to get in touch with you? I want to ask you to give us a number, but I also want you to go back a little bit and talk about that wellness check, because I think that's important. But if people want to get in touch with Valley Area Agency on Aging, how do they do that?
Our phone number is 810-239-7671. And again, it's 810-239-7671. Our motto is we're all things senior, and our goal is to keep seniors in their home and keep them as independent as possible for as long as possible. We have a ton of programs. We screen you for all of our programs so that we can get the perfect fit for you. So if you think you need any help to keep your loved one in the home, or that you want to remain in your home, please give us a call and we'll see what we can do. We'll figure something out for you.
All right, thank you so much, Yoshika. And I want to appreciate you, because I know in this time you've had to do a lot of extra work to even connect with the seniors. And that's why I think this wellness check that you do is so extremely important, because some of our seniors don't have other people in their lives to check on them. And so this is a really important service.
Yeah, isolation it's always been an issue, but it's gotten worse, of course, since the pandemic, because we do have a lot of seniors that don't have access or are afraid of technology. And even if they weren't afraid of technology, they may not have access to the internet or computers or tablets, or not even smartphones. So we do have a couple of programs. One is called KISS, that's called Keeping Independent Seniors Safe. And then we have another program called Chat, and that's Chatting Helps Aging Adults Thrive. The KISS program is where we contact vulnerable seniors once a day just to do a wellness check, just to make sure that they're doing okay, Monday through Friday. And then the Chat program is a little bit different, because it's just calling just to have a conversation with a senior once a week.
Yeah.
Use volunteers for the Chat program, because you truly do have some seniors who literally have no one to talk to, especially during these times. And so that's where we have volunteers where you can just call and just chat with a senior.
Thank you so much, Yoshika. We appreciate you being here. And you're welcome to come back anytime, especially when you've got some new programs that you want to make sure our community is aware of. Because the key here is that we know how to access our local resources during this challenging time. So
I'm happy to be here. And again, please, we do have some openings, which is rare for our programs. So if you are a caregiver, you're caring for a senior, or if you think you need some help in the home, please give us a call.
Wonderful. Now, in addition to, seniors and aging, we have other issues that have been consistently happening in our community, even in the midst of COVID, and heart disease is one of those. We're happy to have with us Dr. Keith Aronson, who is a professor of internal medicine at the Michigan Medicine, and he is also a heart transplant program director of the heart transplant program there. And Dr. Aronson, we want to appreciate you coming today. And actually, we were connected to you by one of our local community pastors. And so we appreciate you coming on to talk to us a little bit. How is heart disease and COVID connected? What do we need to understand about these two? Dr. Aronson.
There we go. Thank you so much for inviting me here. So heart disease is clearly a risk factor for both contracting COVID and for worse outcomes if you have COVID. Excuse me. It's actually most chronic illnesses, chronic lung disease, chronic kidney disease, chronic heart disease, some of the rheumatologic conditions. There really are a host of risk factors for worse outcome with COVID. And of course, immunosuppressed patients, including heart transplant patients, but there's far more, kidney transplant patients, of course, and people with chronic kidney disease on dialysis are all at increased risk. And of course, these risks all, they don't exist in isolation. So when we think of the obesity epidemic in the country and the relationship between that and hypertension, high blood pressure, chronic heart disease, chronic kidney disease, our communities are full of people who have many, many increased risk factors. It is true as well that people who develop COVID can have heart and vascular manifestations. I think probably many have heard about myocarditis, which is an inflammation of the heart. I think there's been, amongst the plethora of misinformation about vaccines, the most dangerous kind of misinformation is when there's a kernel of truth in it, because then it seems more believable. So yes, in fact, there is a risk of myocarditis with COVID vaccination. There was a paper that just came out that put the risk at 1.5 out of 100,000 people who get vaccinated can get myocarditis. Now, the truth is the risk is about 10 times as high in people who get COVID. While both the vaccine-related and the COVID-related myocarditis in general is fairly benign, it's clearly more benign in the vaccine-related version. There is also a condition that can both happen as a result of, or that can happen from vaccines, particularly the AstraZeneca vaccine and the Johnson & Johnson vaccine, the non-mRNA vaccines, can cause blood to become more prone to clot. And that generally happens within the venous system. So it can happen in the lungs or in the brain. But again, very uncommon. In the first, when this was first reported, there were 7.8 million people who had received the AstraZeneca vaccine, which is like our Johnson & Johnson vaccine in the US. And I believe there were 17 cases out of 7.8 million people. So it's important to recognize, while you'll see these cardiovascular risks that are associated with vaccines, the risks are extremely small. In most cases, the course for patients who get the problem is good, and the risks are much higher in the absence of vaccination. The message to our patients with heart disease, as well as chronic lung disease, chronic kidney disease, obesity, is get your vaccines, get your boosters. For our immunosuppressed patients, I think one of the, again, where a little bit of information can be dangerous is, I think people are aware that the likelihood of having a strong immune response, the kind of immune response we'd want everyone to have, is not as large, is not as great in people who are immunocompromised and in older patients. But it's still much, much better than not getting the vaccine at all, right? So it just makes it all the more important to do all the things that Deborah and Paul and Dr. Reynolds brought up about dealing with, taking advantage of all the layers of protection we have. Get your vaccine, get your booster, wear a mask, wear a good mask. If you have access to N95, KN95, KF94 masks, by all means wear them. If you don't, there are, you can tie the surgical masks up where you get the things go around your ear, tie them up right by the mask. Put a cloth mask over a surgical mask. And then I thought I loved Dr. Reynolds' advice about the other organ that's so important to utilize, which is your head. And you know, don't do stupid stuff, right? Don't walk into a bar and go out for a bunch of drinks in a crowded bar in the middle of this pandemic, particularly with Omicron. Now I will, I'm a clinical researcher and a degree in clinical epidemiology, so I like data. But I'll tell you, I'm sitting here in my basement right now because I have COVID. I have no risk factors other than being 63. I'm double vaccinated with an mRNA vaccine. I'm boosted. I've worn a N95 mask or equivalent every moment I've been at work or any other place around people since the pandemic started. It is highly, highly virulent. But to those who would look at me and say, oh gosh, why should I bother getting a vaccine or getting boosted? I feel really pretty good. I had really mild cold symptoms, although I think you heard me cough a bit ago. So, but that said, when I finish this, I'll have finished my quarantine, and then I go to work in our intensive care unit, where at the moment there are, I think 25 people with COVID. So, this is as Deborah pointed out, while this Omicron variant is less, seems to in general cause a milder spectrum of illness. It's a spectrum, and part of what we're seeing is the fact that we have a fairly good number of people who are vaccinated right now, but there are so many more people that are infected, that our emergency departments and our hospitals are getting filled. There are people, we've had to cancel cardiac surgery, electrophysiology procedures to treat arrhythmias at Michigan. And we're not at all unique in this. So people, when you talk about doing the right thing for the people you love and the people that maybe you don't love or even know, that couldn't be more true, because what we are doing, the personal decisions that we make are affecting the lives of people throughout the state and throughout the country.
Thank you so much, Dr. Aronson, and appreciate your transparency. You made me think about the little phrase that we've said over the years: is fact or fiction, truth or dare, dispelling the myths. And some of what you shared with us helps us to look at all three of those. So we appreciate you coming, and stay right here with us if you can. I know you got busy work to do with getting ready for the hospital.
Not for the next few days.
But, thank you so much.
Here in the basement.
Thank you so much for sharing with us. And you mentioned something really, really important. You talked about obesity, and our resident, we call our resident doctor with all of these unique ways of helping us to understand these differences, is Dr. Susan Wolford. So we're gonna ask Dr. Wolford if she'd give us that medical moment. Dr. Wolford.
Thank you so much, Yvonne. Wow, this has been a really, really informative session today. Can you hear me okay?
Yes.
Excellent. So as we said, I get the opportunity today to speak about obesity and COVID. And I'm so excited about that because as that's something I spend a lot of time thinking about. And so what we're going to talk about is adiposity and our immunity. And adiposity is those fat cells. I don't like the word fat, so that's probably the last time I'm going to say fat. And from here on out, I'm going to say adipose cells. So I want us to remember what I'm talking about are the fat cells in our body and how it affects our ability to fight COVID. Okay, so let us dive in. That is a graphic of what an adipose cell looks like. And you can see the area it has to store energy, to store the fat, and then the other parts of the cell. And as I say, at the University of Michigan, my day job is about thinking about obesity and excess weight. So I was so thrilled when this topic came up as something to discuss. There I am exercising with our kids in the exercise program when we had it. So I think this is such an important topic. And what we need to know about adipose cells is just like other cells as well, they are factories, right? Every cell has a job to do. And the adipose cells have a job also. Now, we often think about one of their jobs, which is to store energy, right? We think about that, we know that that's what it does. But one of the other things it does, and they do so many things. I think they're one of the most underrated cells in our body. People just think they're there to, affect how our clothes fit. But no, they have a lot to do. And one of the things they do is help to regulate many of our immune cells. And so we know that in general, when we have excess weight, those stretched adipose cells act differently from leaner adipose cells. And those stretched adipose cells, when we have excess weight, they cause our cells that dampen immunity to go down, and they cause the cells that increase immunity to go up, right? So we're in this chronic state of increased chronic high immunity, which is an inflammation. And that chronic inflammation is bad for our health in so many ways. And we're going to talk about these things. This is more than a one-part topic, so we're going to have to revisit it again. But that chronic inflammation is a problem, and it, in some ways, affects how we can fight COVID. There's another thing that I want to mention very quickly about these adipose cells. Now, earlier, Dr. Kilgore mentioned the Ace2 receptors, right? We've all heard of those Ace2 receptors, and we know that they are in our lungs and our airway, and it helps to let the COVID get into those cells. And we've spoken about that a number of times. But the interesting thing is that those ACE receptors are on these adipose cells as well. And so we believe that COVID can get into these adipose cells very easily. And then just as we store energy in there, we can store up the COVID. So the COVID virus is in there getting to replicate and then getting to send those copies of itself out to other parts of the body. So adipose cells are really very important in how we are able to react to COVID. So I'm going to stop sharing my screen for a moment, and hopefully you can spotlight me so that you can see me. I'm not sure if I'm being, but there I am. Okay, right, here we go. So what I want us to think about this as a lean person. And I'm sorry, I'm going to burst a lot of bubbles today. With COVID, the problems with BMI or adiposity and worsening outcomes, so more likely to be on a ventilator, more likely to die, more likely to have severe problems, it's sort of on a continuum. So as your BMI increases, you get more and more of this. And that increase starts even at what we would say would be a normal BMI. So if you have a BMI of 23, 24, that's probably in the healthiest range. But once it goes up from there, you have an increased risk of having these severe problems. So think of this as a lean adipose cell, fat cell. Think of this as a not lean adipose cell. And let's see how it reacts in our body. So if this is our immunity, you're in the picture, if this is the immunity, and we have all of these inflammatory cells in here, in the lean one, when it comes in contact with COVID, it responds, it reacts, it can fight it off. It's a good thing. We're doing well. But when we have the more, stretched adipose cells that have more of those activated immune cells, When that comes in contact with COVID and that starts reacting, yes, it reacts, but the problem is that it reacts way more than we actually wanted it to. And we have that cytokine storm, and it just overreacts and causes damage to the organs in our body that we don't want it to damage. And that's why we have so many more problems. So with that, I'm going to say that's the end of part one. We'll come back and revisit how these cells or adipose cells, stretched adipose cells, impact our ability to fight COVID at the next medical moment.
Thank you, Dr. Wolford. And I'm just concerned about all that overflow you got going there. But it's an absolute good segue to Dr. Kilgore's presentation. So Dr. Kilgore, we appreciate you because you're doing a round two as well for coming back and helping us to understand more of this from that perspective that you share as an environmental specialist and an infectious disease physician. Dr. Kilgore.
Thank you very much, Yvonne. And I am going to get my slides up here so you can have them. And by the way, let me just point out, I will make sure you have these so you can distribute. Okay. Here we go. Yvonne, are you seeing quick comments slide there?
Yes, sir, we are.
Oh, fantastic. Okay. You see a full screen?
Yes.
Wonderful. Okay. So one of the things I want to point out is that I mentioned the virus is evolving. And one of the things that we've always been tracking for now decades with different pathogens is how well they infect other people. So the number for everyone to know is this R naught, this R is sub-zero. That is a number that indicates the number of people that become infected from a given person. So look here in the upper left, the original virus, about 2.5, almost 3 people were infected from every one. Now, we moved up to the Delta. The more recent data we have for the Delta is that it's a 5 to 8 factor. With Omicron, we're thinking right now that it's elevated much higher than Delta, probably a little bit below mumps and measles, but you can see here when we have measles circulating, highly, highly infective, super transmissible. That's why it's very easy to pass measles, mumps, and now Omicron to other people. So I just want to talk a little bit about vaccination because that's really what's foremost in our minds. I'm thinking, what can you do to prepare yourself for vaccination? So first, you want to schedule that day of vaccination and write it down, but then prepare your schedule ahead of time. So make sure you have a meal planned out, get your food prepared ahead of time if you can, and make sure it's a healthy meal, fruits and vegetables and proteins, all that good stuff that we know is in a healthy diet. And then my suggestion personally, go for an afternoon appointment. The reason is that you can go in maybe at the end of your workday if you're working, or just before you get home with the family, and then you can rest at home. You don't want to be vaccinated and then have to go into work. That's my recommendation. And then plan to go to bed early, sleep early, get lots of sleep. We want you to hydrate, hydrate, hydrate. As you can tell from my voice, I'm hydrating right now. And one of the things that I know is that winter months here in Michigan, super dry, we lose fluid through our nose, mouth, skin every minute, every second. So make sure before you go to the clinic, make sure you're drinking a glass of water or two before you go into your clinic appointment. Stay well hydrated. Take a bottle of water or two when you go to the clinic, because you're going to have a little bit of downtime as you're waiting there after you get your vaccine or even before. Right after you get your vaccine, you're sitting there in the clinic or the pharmacy, start massaging your shoulder. One of the things that we want to do is get the vaccine moving through the muscle tissue, into the capillaries, get it into the lymphatic system, in the immune system as quickly as possible. But spreading that vaccine through your muscle will actually help reduce the concentration. It'll help you actually move that vaccine to where it needs to be ultimately, which is the immune system. So You can move around, but just make sure you're doing that right after you get the vaccine. Now, remember your immune system, this lymphatics, the plumbing parallels the circulatory system that Dr. Aronson knows better than anyone. And the key thing I think with the lymphatics that you want to know is that they're linked up directly with your lymph nodes, and that's where the vaccine's going, and that's where it's going to actually do its magic in creating the antibodies to protect you. One of the things that came up in previous discussions, I know, is discussion around the vaccine and the distribution of the vaccines, how they got to be so quickly developed. To tell you the truth, we've been working on it for years before COVID-19. The mRNA platform had been established with the Pfizer platform, the Moderna platform, already people working on that for many years. We also got much more efficient. And the bottom line is we do all our data collection, Moderna trials and COVID-19 trials in Detroit. We do those using the computer. The only paper we have is an informed consent form, to be honest. So we're very efficient in collecting information, processing it, analyzing it, plus the fact that we've had really thousands of participants across Michigan and across the United States being in the trials, which helps speed it up. So we've really been able to move it forward fast. Plus, to be honest, BARDA and all the money that's put in by the federal government to enhance vaccine development, that's transformative. We didn't have that in previous years for many different vaccines. Are the vaccines safe for you and your kids? Absolutely, yes. There's a lot of data accumulated already. I won't go into it completely, but here are the links, and you'll have it in the websites that you can check out a little bit later. And it's broken down by age groups. You can see what it looks like in kids, middle-aged persons, and older people. For every group that we've looked at in the trials and in the post-licensure data with the trials, the vaccine profile is very safe, both for local adverse events and systemic signs. Most common local sign, pain at the injection site. That's why I mentioned massage your shoulder, get that vaccine moving through the muscle. Question, is it possible for you to be protected from COVID-19 but still transmit the virus to another? Maybe yes. It looks like that may be possible. We know the vaccine gives you high antibody levels that are going to prevent you from getting serious illness. I mean, you avoid the intensive care unit that was mentioned before. You avoid death, and that's a good thing. But if you become exposed, you may become infected. That's true. If you become infected, you can give the virus to someone else in your family or people around you. Wearing a mask that fits around your face is still very important for everyone, vaccinated or not vaccinated. What you need to know now. So older people clearly are at higher risk for death and severe hospitalization, severe disease, ICU visit. They especially need the vaccine and the booster. Get vaccinated as soon as possible, without a doubt. The younger kids too, we want them to get vaccinated, feel safe in bringing them to a vaccine clinic. And if you have any questions, you can call me personally. Yvonne knows my phone number. You can call me anytime. And the preventive measures, we're talking about wearing a mask, the social distancing, absolutely. The ease with which the Omicron virus and Delta certainly pass from one person to another is unquestioned. We know this virus is super transmissible, much better than the first virus back in January 2020. So susceptible people, meaning unvaccinated people, are at high risk for getting infected. And all bets are off. When an unvaccinated person gets infected, I can't predict what their outcome would be. A close colleague of mine in Houston, Texas, just passed away December 7th after a 2-week illness. I think the fact that he was ill and in the hospital for a prolonged period of time, and his delay in getting in and just unvaccinated status was really, really a major problem for him. So, do you got a mask? Get a mask? Absolutely. There's all kinds of masks around. One of the things I was looking up today was where free masks are available in Genesee County. I think I'm going to ask Yvonne to speak to that along with the AAA Agency on Aging to find out where you can get a free mask. Free is good. KN95 is good. The surgical blue mask is okay, but there's also a gap sometimes with the surgical mask. If you have a cloth mask, I would combine it with at least a surgical mask. But ideally, you want a KN95 or the 94 mask that was mentioned earlier by Dr. Aronson is great, because this virus loves your nose. It loves your mouth. It loves entering even through your eyes. So don't touch your eyes. Don't put your fingers in your eyes. Don't rub your eyes. What am I doing personally to protect myself? I got the booster, so I've had 3 doses. I'm masking literally everywhere. I'm seeing a lot of unmasked people out there. I'm social distancing wherever possible when I'm in a grocery store or something like that. I'm not going to large gatherings. I'm avoiding conferences, unfortunately, right now, but going online for those. And a healthy lifestyle, certainly no smoking. That's number 1. I would reduce, or you could avoid alcohol, that would help. Reduce your sugar. You heard the diet recommendations. Avoiding that inflammatory diet is key. Fruits, vegetables, and stay hydrated. That'll help a lot. Personally, the other thing I do, I in the computer a lot, so I use eye drops, and I'm hydrating my nose even with the nasal spray. So I'm getting enough sleep as well, and that's going to help your immune system. After you get vaccinated, make sure you get a lot of sleep. That'll help get that vaccine kicking in quickly. And that's it. Thanks.
Thank you so much, Dr. Kilgore, and we'll look forward to those slides so that we can make them readily available for whomever might need them. And we're going to ask Sherelle to come quickly as we round out. One of the things that you mentioned is like where to get masks, and masks are available. And I'm sure Sherelle can key in on this, because at most of our testing sites, they do have masks that they make available at no cost. So Sherelle, can you come and just give us an update on where the clinics are this week in our community?
Yes, good afternoon. It's good to see everybody. So we'll be at our stand-in locations on Tuesday at Our Lady of Guadalupe from 12 to 2 p.m. Wednesday, Central Church of the Nazarene from 10 to 12 p.m. Thursday, we'll be at Shiloh Missionary Baptist Church from 3 to 6 p.m. And we'll also have a pop-up clinic at the U of M North Bank Center downtown on Thursday as well, earlier in the day from 10 a.m. to 12 p.m. And as Yvonne said, we do make masks available at these clinics. The health department is currently working on getting more masks and KN95s here so that we can distribute to the community. And it's very important that you all continue to get tested and get your vaccine. So some of the places that you can go to get tested in the community includes Word of Life Church, Bethel United Methodist Church, Macedonia Baptist Church. The lines are very long because COVID is rampant at this time. So get you an appointment or just go get tested, stay safe, wear a mask. And you can also visit Rite Aid, Walgreens, or Hamilton Community Health Network for a free COVID test as well.
Thank you so much, Sherelle. And we also want to mention that Valley Area Agency has available masks for homebound seniors, and you can call that number 810-239-7671 if you need masks for seniors. And as she said, please register, because those sites the lines are long right now for testing. So thank you so much, Sherelle. I got a quick minute for Kiana. Is there an update for this from the city?
Good afternoon, everybody. Happy New Year, since I have not been here. Just a really quick update. The lobby at customer services, where we all go to pay our water bill, had been closed this week as a result of some COVID exposures. And we're working to make that space safer. So we are, again, using the walk-up window just outside City Hall to pay the water bills and any other monies that go into customer services. So we wanted to make sure that residents know to use the outside window at this time. Once the lobby is back open at customer services, I believe the communication will go out so that everyone will know. And just in case, if anyone needs to pay their bill via phone, they can do so at 844-392-3653.
Thank you so much, Kiana. As we prepare to close our session for the day, we want to remind you, local context. The schools are providing meals for students, and There's distribution that will be available today. So please know that if you, for whatever school you're with, contact that school so you can find out where to get food for your children over the weekend. Continue, community health workers and our social workers, apply for the continuing education units and contact hours. This webinar is available for you to get those. We also want to let you know that you can join us, like us on Facebook, be a part of this connection and information opportunity. Subscribe to our YouTube channel, Healthy Flint. And as always, if you have any questions or you know someone that would like to join us on the webinar, they can go to info@hfrcc.org and be connected. Call us at 810-835-2130. A lot of information shared today. I just want to remind you, we're going to be talking about fact or fiction, truth or dare. Let's dispel the myths and let's make sure we can do what we need to do in our community to make a difference. Please remember to join us next week for the Healthy Flint Research Coordinating Center's Flint Community Webinar on coronavirus. Next week, we'll be right here looking to share with you again. Thank you for joining us today.